questions in the audience? Yes, all the way in the back.
What would you say are the biggest barriers to preparedness, and what can we do collectively to try and address them?
So the question was, what are the biggest barriers to preparedness, and how can those be addressed? I'm not sure who wants to tackle it.
Oh, points at me.
Everyone's pointing to you.
Awesome. Easy question. I'd say the biggest barriers to preparedness, well, there's an intersection of them, right? So one is kind of how we have talked about preparedness. We talk about preparedness as if it's something, as if we're doing things for something so far out. And so at a community level, they're like, this preparedness stuff, whatever, like I got problems today, like right now. And so the more that we can integrate the conversations into things that will help people today, right now, will help kind of at the community, individual, household preparedness level. I think the other challenge to preparedness is institutions and siloing, right? So this idea that, you know, I'm an island of resilience, right? I have all my backup systems and my generators and everything's up and yada, yada, yada. But if everything around you has been destroyed, how resilient are you? And so I bring that up to kind of point to the fact of collaboration as a big challenge. I've responded to a number of disasters in the city of Boston, and including the marathon bombings, and collaboration is by far, collaboration in the voices of people in communities is by far the most significant determinant of how successful outcomes on the other end, and not just success based on how I measure it because I have a list of things I'm measuring as an organization, but in terms of the voices of communities that we're actually ultimately on the receiving end of what we're doing around emergency preparedness.
Okay.
I'll just add to that to say resources are always a need and partnerships are always important. Many of those I see around this room. But I will add, sometimes this work is hard because it's hard to ask yourself those pointed questions to say, what didn't go well before? And to be able to have that humbleness and that authenticity to say, you know what, I'm gonna ask myself this hard question and be okay with the response to say, there are things I can do better. And to be able to create that culture within all of us, whether it's a donor or a partner or a beneficiary you're working with, and to really challenge them and change that culture so we're okay talking about that so we can be coming out on a better end.
Yeah, you mentioned resources. I think the challenge from my perspective is that disasters, as I said earlier, are things that are unpredictable and therefore people think they can't control. And so committing resources to say, let's build the resiliency, let's build the systems to be able to respond when we can respond, requires governments, it requires the private sector, it requires individuals and communities to say, we're going to commit the human capital, we're going to commit the financial capital to be prepared. And I think people don't want to do that because they think it's not going to happen. And so let's invest somewhere else, because the likelihood we're going to get hit by a hurricane is so small. Let's invest elsewhere. But I think the likelihood you're going to get hit by something is pretty high no matter where you are. And so to invest the resources to be prepared at least at some level.
Yeah.
Great conversation. Great conversation, really appreciate it. Wanted to get your perspectives on thinking about those who are on the front lines of care, caring for others, and what more we can be doing as supporters of Americares' great work to care for those who are caring for others and keeping them resilient and in the game.
So that's a great question. I know we'll hear more about mental health later today, but we've really invested in caring for others, for healthcare workers, social service providers, emergency responders who are on the front lines. They're also affected by disaster. And so it's almost a deer in the headlights to say, well, what can I help you better serve your patients with? They're like, well, I'm affected myself. And so we've developed programs that we're rolling out in places like Texas and Puerto Rico and others to build those coping skills so that they can have those tools to be able to say, okay, I'm going to take a moment for myself, and here's what I know I can do right now and over a period of time so that I can better go back to my job.
We have another question here.
Can I just add one quick thing? The only thing I'll add is this concept of collective care. We talk a lot about self-care, but but it's hard to take care of yourself if you're in an organization or in institutions that don't give you the space to do that, and that don't help you understand what it could look like for you to take better care of yourself, and get help with resources to support that. So I just wanted to offer that as also part of this conversation, that it's not just individual responsibilities, that these things are all interconnected.
One thing to do about this is, I think, to keep asking that question, because I think it's invisible. We forget about it, and I know people who responded to Haiti who are still to this day affected by what they saw in Haiti, and don't talk about it because there's nowhere to go to talk about it. So I think it's really, really important. Just keep pushing that issue and asking that question.
My question is for Atia. Is on. Some of this work, or background work, is the work of government and institutions establishing good education systems and good healthcare systems, et cetera. How do you balance the policy needs with the other work that you're doing?
How do I balance the policy needs?
Do you advocate for policy, for governmental policy change?
Okay, so at the higher levels,
Yeah.
right? So that was so I had to put my former hat on. So as the former Chief Resilience Officer for the City of Boston, one of the interesting things that I found during my work was that a lot of the policy shifts that need to happen to benefit those who are disproportionately impacted, the most socially vulnerable, are the same things that benefit everybody else. I know that's a shocker, right? But I want those words to just sink in for a second. Because what's happened is we've built systems and structures and policies that work for some of us really well, and so and like we figured out, we've jerry-rigged our way through navigating a maze of hot messness. That's an official term. And the rest of us have had to figure out how to navigate these mazes, and the lower on the social totem pole you are, the harder it is to figure out how to navigate. And so when you look at different policies and you're like, okay, let's look at education, right? So there are these challenges with how folks are able to prepare. I'm pulling actually I'll do an emergency preparedness one. So for around emergency preparedness, how are we doing community preparedness in neighborhoods, right? And so right now, there was a point in time where everyone was running around doing individual work, right? So American Red Cross was doing stuff. Different city agencies were doing different emergency preparedness stuff, and it was a hot mess. And then you had FEMA was doing stuff in communities too, and no one was talking to each other about, well, how are we talking about preparedness, and are these messages customized to the people on the other end who are actually trying to engage with? So if I go in and I tell a community, a low-income community, hey, you need supplies for 7 days for each individual person in your household, number one, they're going to look at me like I have 10 heads. Like, I'm still trying to figure out like how I'm going to pay for my medications this week. So the idea that you're telling me that I need to store 7 days worth of stuff, I need to tweak my message when I'm in that community to figure out more collaborative, collective ways to connect people to resources that are in their communities. And so from a policy perspective, there's a lot that we can do to better customize our approaches. That's one small example. And I think the key there is this idea that we're, by customizing it, we're actually making it better for everyone. Because if I go into a different community that I know, you know what, when I go into this community, I need to have this message because their religious institutions in this neighborhood are really important to them. So that's going to be centerpiece to how we talk about preparedness with this community. So I'll be quiet there. I said too many words.
I think that the big problem here is cost. We can do the small interventions like training the janitor to use the fire extinguisher, but if terrorists fry our power grid in this country in winter, millions of people will die immediately. If we have some pandemic for which there's no immediate solution, no immediate response, and these are things which cost huge sums of money. And of course, the people who are most vulnerable, the communities that are most vulnerable, have the least money to put into these kind of initiatives. So I think that's the small stuff, the small disciplines we can manage them better than we do probably, but it's the big stuff that really scares the hell out of me.
That might be a good one for you to tackle, David, actually.
Thanks. Thank you very much, Erin.
I'm just here to support you.
So I think you're right. It's a little bit what I said earlier, is being prepared for the things that you don't expect, and making the commitment to be prepared for that. So I think one of the things that we can do collectively, I think Americares does a really good job at it. I think the private sector can probably do a better job in their government affairs relationships. I think the community in general should push our leaders, our government leaders, to say we need to have the financial wherewithal and in the backdrop to be able to respond to these. But I would say beforehand, we need to be able to commit the financial resources to be prepared so that when the grid does go out, we have built in place, by financially investing, built in place the backup systems so that if the grid is attacked, we can recover from that. If we have some other type of attack or crisis or disaster, that we can recover from that. And I think one of the challenges is this is not related to any particular government or type of government. Like I said earlier, if it's not in front of us, we tend to say, well, we're not going to invest that much right now because we have other priorities. And it isn't until something like Ebola happens that suddenly we say we have to build 65 Ebola treatment units around the country, which ultimately never got used, but it was a knee-jerk reaction. We spent billions of dollars doing that. Had we thought about pandemic preparedness ahead of time and had thought about what the consequences were and built those in a way that would be more cost-effective, we wouldn't have had to spend those billions of dollars as a knee-jerk reaction. So it's really being able to get government, all of us, government, private sector, communities, to invest in preparedness, just like we're talking about, so that when it happens, we're not spending as much money to respond, and we have those backup systems when that crisis happens.
I just want to add something really, oh, I'm sorry, go ahead.
I was just going to say quickly, how can we create that collective sense of urgency to go and help push forward with those issues?
And then the only other thing I was going to add is this idea of, we used to have this principle in emergency management, well, I guess we still do, all hazards approach, that there are certain capabilities that we have to develop that regardless of the type of disaster, like we just need to have. And there's been a lot of work over the years in investing in those types of capabilities. And so I think there are opportunities to figure out beyond government, what are the ways that we can have cross-sectoral collaborations and partnerships that allow us to really do a deeper analysis on where we are with our current set of capabilities and where we need to be in order to address the more emerging threats that we're challenged with as a country. If anyone's interested, you can read the National Preparedness Report that the federal government puts out every year that begins to scratch the surface of what are some of those challenges with capabilities that they've seen based on actual disasters they've responded to. And it's actually really interesting to be able to see, like, there's actually capabilities we're really good at as a country collectively.
I'll add one other thing to that, which is a really good point. I'll add one other thing. We're a very security-minded society right now. We want to be secure. This is a security issue. It's an individual security issue, it's a community security issue, and it's a national security issue. If the grid goes out, to your point, that's a national security issue. So let's think about this from a security perspective and drive that message home saying we need to invest in this.
Great. Kate, David, Atiya, thank you all. Thank you for your questions.